Hello, so this is clinical reflection number 6, and today was a good day. I'm going to say that we did have a lot of new admissions come in, so I did learn a lot of new things, saw a lot of new things, and met new people. Something that caught my eye was a 29-year-old male who was admitted. Um, he was actually transferred. He was in the ICU unit, but he came over to us once he got a little more stable. But he was admitted for abdominal pain. He was opioid dependent. He also was admitted for cholelithitis, which is the formation of gallstones. So he has a history of substance abuse to fentanyl, and that's injected to him. He's currently obese, and then he has a history of tobacco use, anxiety, and depression as well. And then he is currently on suboxone. So he has many consults. He has a consult for general surgery, most likely to get the gallstones out because he is experiencing low urinary output. So it was very low to where they had to insert a Foley catheter for him. But whenever they did get more urine return, it was as low as like 8 milliliters. He also had to get gastroenterology. He had to see nephrology, infectious diseases as well. So he was on a cardiac diet. He did have a 22 IV, the right arm. He also had SCDs on just since he is on bed rest a lot and is sort of like immobile. So that's going to prevent him from getting any like clots or anything stuck in the legs. He was A&O times 4, so he was attentive. Um, he was well aware. However, one thing I would say is I'm not quite sure if he knew how serious his condition was. So I did have the opportunity right then or there to kind of like talk about his diagnosis with him and kind of give him more education, but kind of like break it down in a way that even I can understand it. So I wanted to help him better understand his condition so he can know how serious it is. Because he was very kind of like standoffish or lean. It didn't quite seem as if he quite understood how serious this was. Like for example, one of his labs came back really low, which was his hemoglobin. His hemoglobin, when he was admitted, it was 8.2, okay, but eventually it dropped to 6.8. So therefore, we had to do a blood transfusion for him. And as we're going through the blood transfusion, we must always sit with the patient at least 15 minutes after we begin that transfusion to, reassess vital signs to see if there's any adverse reactions to the transfusion. Luckily for him, there were no adverse reactions. He tolerated the blood transfusion well because this was not his first one either. So he was used to getting blood transfusions. Um, but upon the 15 minutes of waiting on him, he was kind of rushing us to leave, because he wanted to get back to his shows. I completely understand. But we did have to reinforce the importance of we must stay with you until the total 15 minutes is up so we can make sure this transfusion is operating nicely for you until you're not experiencing any hives or maybe shortness of breath or any allergic reactions to the blood. So as soon as we educated him on that and how important that was, he understood. Um, and he allowed us to stay in there, and that's when he allowed me to just educate him more on the abdominal pain he was experiencing and the gallstones that were found. As far as his bowel sounds, they were very diminished, so hypoactive. You didn't really hear anything, so that was also a concern for him. There was a CT abdominal done, and it showed pancreatitis, so he has an inflamed pancreas. It also showed positive for ascites, so that's where the inflammation is probably coming from. Um, he also was on dialysis before he got to the med surg unit. So he had to get dialysis. Unfortunately, the urine output was just lower and lower to where he was barely even putting out any urine. So that was a concern. So he went ahead and just started dialysis. So that was his first time on that. So that's the route that he'll be going. But the plan of care for him is getting his labs back at a normal state and reducing his pain and providing comfort to him. And most importantly, education. To me, he's very young, 29 years old, so I did want to educate him more on, the health and his age and everything. So he really appreciated that. And considering the fact that he was depressed a little, just trying to show compassionate care towards him, letting him know that he's not alone, and that the reason that we're here and the reason that I'm here is because I want to learn more about his diagnosis to help him and make him, feel better and more comfort for him and just to reduce that pain. So he was very open about that. So it was nice to educate him on that. So after a while, they did say my nurse actually found out that the day prior to him being admitted to us, they had to he was a rapid response basically, so that also was a bit concerning. So for him, we had to continuously check up on him, monitor him, actively check the vital signs and labs just to make sure things were flowing properly and things were going in the direction that we wanted it to go in, especially so we don't, so we can prevent him from being another rapid response victim. um, so a lot was learned during that session. I'm glad I had an opportunity to speak with him. Hopefully, me showing my compassionate care, being with him, being in a calm demeanor, talking to him, I hope that really helped him, and hopefully it can help, resolve his depression, make him feel a little bit better, and hoping that he gets the help that he needs. So the main takeaway today, always being there for your patients, because sometimes they don't know how critical their condition is, or they may not have the resources in their life to, warn them or tell them that this isn't going to help them better. So I'm always trying to be a helping hand and cheer someone up. So that was a really great experience for the both of us. Thank you.